Okay, I can say there are many improvements that I have observed that are there, and of course we're going to improve more. Uh, the last time I think we met with is it Ma? You met here. There are a few things also they wanted of course their complaints from the communities, and then we see this on the social media, and they came just to confirm these things are true. And I told them it's true. There are some things also the community are complaining about are there. Those things are there. We cannot deny. But we have improved over time since then up to now, because we had the issues around the generator, as I said. We didn't have a backup generator, and then we had the issues of electricity. And if you don't have electricity, then it impacts a lot on sub-delivery. But now our generator is on, being serviced. It's on now. We had issues around the laundry. The laundry, we had machines that have stayed there for some years, not being used. I'm happy to say now that our casuals used to wash clothes using their hands. So now at least those machines are on. And the biggest problem with those machines was because of electricity. So we had transformer. So we got that transformer. Once we got that transformer, we had to do an upgrade of our generator. So now we have electricity in our laundry. That there's a cable that ran from up to the laundry. Now our guys are doing laundry not using their hands anymore. We have the mortuary. The mortuary was an issue then, and we used to use only formalin, to preserve bodies. And so as we speak now, our chambers are on. They can accommodate at least 12 bodies for now. Chambers are on. So we're just waiting for commissioning from the governor, but we are already using them. So those issues we used to ferry some bodies to Malindi because of that. There's some bodies that are maybe decomposing, that are picked from outside. We couldn't keep them here. And there are bodies that maybe needed some postmortem. We still couldn't keep those bodies here. But now we're doing that. Issues around, we had issues then about ultrasound machine and the X-ray itself. So those ones are up and running now. We don't have any issues with scans. So we can do all the scans. We can do any X-ray now. So that is okay. The other issue we had was space in terms of maybe the ones. So now the county government at least did something. We have 2 wards up there now, including some private rooms. So for those who say administrative labs were this year, because I remember there was a time a patient was brought here and the son was saying, no, I can't let my dad be admitted here. It's not my level. So, but now we have private rooms. We have, I think in the next 2 weeks, they'll be ready. So the private rooms and a female ward plus a male ward up there. So I think those are some of the things that we did since the time these guys came. And of course, they are coming here and asking those questions. Really impacted on something, and it gave us ule msukumo wa kufanya vitu. Because now, if they are coming here on behalf of the community, come and tell us, hey, patients are complaining that you don't have drug, you don't have this, you don't have this. Of course, na sisi tunaangalia what we can do. And since then, we have improved a lot in terms of even commodities. I think the noise that we hear from social media now has it has gone down completely. I think that one we can attest to it. Because initially, every day you wake up in the morning, I'm sick, there's something on Mpeketoni Sub-County Hospital. Oh, there's no gauze, mara sijui patient amefanywa nini, there's no referral, those things. So these things have gone down. We have tried, and the game changer on all this is what we are calling FIF. FIF is Facility Improvement Fund. So now the hospital can budget, we can budget the revenue that we collect yeah, we budget for that revenue and improve on hospitals, and that's why it's called the Factory Improvement Fund. So we had at least this is the second the third quarter that we are doing those budgets. So whatever we collect here, it remains here. So this is now we do our budget and now do some improvements. So now we will see like things like roofing over maybe X-ray. We don't need the county to do that, so we do it hapa tengeneza peta zetu, but still we have to go through the procurement process, but we do it here. We want to fence his walls because we had I think I told them last time we having challenges of patients absconding. So a patient comes, is treated, hospital and die like 20,000 and the patient goes. So now we are doing some fencing. Now we leave only one entrance so that all patients will be there. We are providing patients uniform so that you cannot get out. Ukitoka unaulizwa. The biggest problem, the challenge we have, and I think our friends really have to assist us, is patients absconding, which is wrong. Why should you come to a hospital, you get treatment until ukipona, then you run, unatoroka? You would rather come to the office, sit down, we discuss. Could be having but you have some goats huko, so you umepanda mpamba, and discuss how you can pay that bill. But that is the biggest problem we have now. Of course, some issues again around human resource. It's never enough, and I have appeared to give. So you'll have some shortages of nurses, medical officers, clinical officers, but we are doing with what we have.
John Monene Kome. Mimi ni community champion wa MOP committee, na mimi ni mkazi wa Mpeketoni. I'm a youth from Mpeketoni, and within the community I play a role of being a paralegal. I'm a paralegal within the community, so tunajaribu hamasisha ama kuelewesha wananchi kuhusu matumizi ya sheria hasa kwa mambo ambayo yanahusu mambo ya jamii. So tumepewa mamlaka hayo na tumepewa jukumu hilo. So that's who I am. Let me say MOP committee engaged us, and one of the places we've been working in and tumefanya follow-ups in the hospital. We actually came here. So if you want me to talk about the improvements, you will allow me to compare the hospital we got that time and the hospital we have this time. So there were plenty of challenges. And the challenge was between the community and the hospital, because hospital is an administration, iko na uongozi wake, na jamii we understand the community is very free. So there was some misinformation that was being taken to the community. Also there were some gaps to be addressed within the hospital. So we came and we identified the issue exactly, and we have been trying to elaborate to explain to the relevant people upon what to be done. We have some times with the community trying to explain to them on where to do some follow-ups and how to do follow-ups. That is their right to have information. Like we had this training with the MOP executive to train about information, right to information. That's Article 35. So tumekuwa tukihamasisha wananchi na jamii kuhusu haki yao ya kupata information, kupata habari. Na tulikuta ukiwa na shida moja ya madawa, watu walikuwa wanalalamika madawa sijui yanauzwa, madawa sijui wanatumwa wakanunue madawa nje, madawa ya hospitali. So kulikuwa na hizo hadithi nyingi. And within that right that is granted to us by the constitution, tulikuja tukaongea na MEDSA na akatuelezea kuhusu the procedures of how wanaacquire madawa au wanapata madawa na vile wanatumia madawa. Na ni kweli sometimes kuna kwa shortage ya madawa kwa sababu ya supplying, na wakati madawa inapungua kuna procedures za kufuata, procurement procedures za kufuata ili wapate madawa. And now you see a normal citizen without that knowledge, yeye akija akipata dawa zimeisha, I think they don't understand of the procedures and whatever, wana end up bust like hospitali this, hospitali that. So we take that initiative ya kuelezea community of exactly what is required of them, and that hospitali, a government institution, cannot just appear, cannot just run as we wish. So tunatumia opportunity pia kuelewesha. So we are trying to break that gap, to shrink that gap between the hospital administration and the community that's being offered the services too. So that's what we are doing. Kazi kubwa ambayo tumekuwa nayo, kwanza tumekuwa tukijaribu kuhamasisha na kuelewesha wananchi kwamba they have got right to ask. Because kuna mtu anakuja asipate huduma ambayo alikuwa anapenda na asiulize, anaenda kulalamika huko nje, anaenda kuongea huko nje. So kunakuwa na dhana mbaya, lakini tumejaribu kuelewesha wananchi kwamba wako na haki ya kuuliza. Hata ukija kutibiwa, before utibiwe ama before usubmitiwe kwa doses, you have right to ask. Uliza, ni nini hii ambayo unanifanyia? Unanirifaa niende kwa nikafanye nini? Ask all those questions until you are comfortable with the service given to you. Go to the medical superintendent, muulize maswali. That person is a civil servant. You have got right to answer you. He's there to help you. Ulize hizo maswali until you are contented with the service offered to.